So we keep going down that path of talking about ways of how to naturally, holistically enhance that dose, that conversion of serotonin in the body. Because we want to mitigate certain things. Obviously the depression, obviously the anxiety, the rage, the paranoia, the insomnia, things like that. And as we talked about the last 2 days, binge eating, emotional eating, in order to just temporarily, almost artificially boost that level of feel-good serotonin, short-lived and not without consequence. So we keep going down that path. We want to touch on today one that we've talked about a little bit in the past, but it is an often overlooked one. It's the art of actual breathing. Overlooked and underappreciated. We just assume we're doing it right, but what's right, what's wrong? I guess when we understand more of the mechanisms behind it, then we can make that determination for ourselves and see how it fits into our lifestyle and our goals. We talked about in the past getting tryptophan to 5-HTP to our desired destination, serotonin, requires a few cofactors to get us there. One of them being oxygen. We want oxygen to be plentiful in order to potentiate this conversion and get us to serotonin. Now, here's where it comes into play. The oxygen in our body is obviously determined through respiration, but what most of the population has a tendency to do is almost overbreathe. You know, we always refer to people saying, take a deep breath, okay, deep breath, deep breaths. Depending on your understanding, and walk with me now, be open-minded, that almost potentiates something overbreathing, almost like a hyperventilating state. Overconsumption of oxygen. I can tell you why this would be problematic. While it is true, if we're breathing like that and taking in more oxygen, we do a pulse oximeter reading, which measures the saturation of oxygen to your blood, your hemoglobin in your blood. That reading will be high. That reading will be up high, no doubt. But that's only part of the equation, and perhaps not the most important part of the equation. That oxygen that comes into the body, O2, and is bound to hemoglobin, that's one step. It's in there, great. But now we need that hemoglobin to release that oxygen to the tissues. It needs to release it in order to be used by the tissues for various functions, plentiful function, mitochondrial function, this serotonin conversion. We need it to be released. This is something that's called the Bohr effect. And the Bohr effect was noted that hemoglobin, and whether it will release, or to the degree which it will hold on to oxygen and not let it go, or release it freely to the tissues, is actually driven by carbon dioxide levels, not oxygen levels. Meaning, and this is somewhat paradoxical, counterintuitive if you will, but it's been observed and noted for years now. As carbon dioxide levels go up in the body, all of a sudden that hemoglobin more freely releases the oxygen to the tissues. It's almost like it senses the carbon dioxide going up. Man, we need to oxygenate these tissues quickly. We need to let this go and let that oxygen be bioavailable and usable for the tissues. One way we can start to hone in on that, and you see a lot of people do this already, is when you see people doing altitude training or oxygen deprivation masks. Or even breath work, where they're holding their breath a little bit and creating more tolerance to the discomfort, initial discomfort of some carbon dioxide buildup. Ultimately, it can be releasing more oxygen to your tissues to be used for this, our desired outcome, and others. One of the ways I started doing this, and some patients have started doing this as well, is simply switching to nose breathing. When you're mouth breathing, due to the other issues it can cause, postural, musculoskeletal, and otherwise, as you nose breathe, you start to take more slower, controlled breaths right there. A little bit more buildup, a healthy buildup, a low buildup of that carbon dioxide. After that, started to do some activities, exercising, even with the mouth closed for the whole activity. One other way is something called a Bolt score. And you can kind of check yourself on this. Obviously, don't do it if you're driving or if you have issues with breathing. Always consult your physician. But what you do for the Bolt score is you just take a normal inhalation through the nose, normal exhalation through the nose, and when you get to the end of that exhalation through the nose, you just hold your breath. You can facilitate this, prevent cheating, by holding your nose. When you hold your nose, then you just hold it. Use a little timer. See how long you can hold your breath before that air hunger kicks in. We're not talking about the face turning red, getting lightheaded, anything like that. We're talking about a little bit of discomfort. The air hunger almost when you get a little flexion of that diaphragm. That diaphragm might spasm like, where's my air? 15, 20 seconds, you might have some work to do. A lot of high-level athletes, they want to get up to around 30, 40 seconds before that air hunger kicks in, meaning you're tolerant to that carbon dioxide increase that is going to also increase the oxygen delivering to the tissues, the oxygen availability to the tissues in your body, thus increasing things like the coveted VO2, your ability to uptake and utilize VO2 max, uptake and utilize actual oxygen in your body. Why is this an issue? Let's double back, see the forest through the trees, because like we said, we need oxygen. We need oxygen to get that tryptophan ultimately to serotonin. So in addition to all the other things we can do, mitigating tryptophan steal by lowering our exposures to toxins, getting rid of the toxins within, lowering stressors, physical, mental, emotional, chemical on all levels, decreasing inflammation. We talked about how that can propagate tryptophan steal and lead to lower serotonin levels. We talked about yesterday how exercise can help. Well, you know what? Why don't we focus on the lost art of breathing as well to increase oxygenation to our tissues? In and out, all of a sudden, we got a little bit of carbon dioxide buildup. We're not over-breathing. Oxygen is released, and oxygen can facilitate a plethora of functions in the body, but for our purposes, that release of that oxygen and getting that tryptophan to 5-HTP to serotonin, and we're feeling good, feeling great.